Ngozi Enonwa Ejedumo is a cancer survivor who regularly travels abroad for treatment. Her next appointment is in India in May, but because of the global pandemic, she fears she will have to miss it. And she says the local hospitals here in Nigeria don't offer any hope.
If you find out that there's something going on with you right now, you can't go to the hospital because they're already short-staffed. You can't go to the hospital, and even if you decide to call in, it will not be considered an emergency. So whether you like it or not, you have to wait till the lockdown is over before anything can be done. Even those on radiotherapy treatments, a lot of their treatments have been cancelled.
Her concern is echoed by many in the country.
There's a lot of confusion because, you can't self-medicate on a lot of illnesses. So there's just a lot of fear and confusion.
Thousands of Nigerians regularly seek medical attention in other countries every year because of the poor state of the public healthcare system here. The travel restrictions imposed by countries around the world has now forced many, including the rich and the powerful, to stay home and rely on the same health system they neglected for decades.
Whereas you had a clear dichotomy on just the middle to lower class using these hospitals, right, the public hospitals initially, now you have an added on effect of more persons now having to utilize resources for obvious reasons because they cannot travel.
The increase in the number of people using local hospitals is adding stress to a system that's already in a bad state. Many here hope the pandemic will force public officials to focus on improving Nigeria's healthcare system. An estimated $1 billion is spent by Nigerians on overseas medical treatment every year, including government officials. In 2017, Nigeria's president spent about 20 weeks in hospitals in the United Kingdom. Although government promised to address the problems in the health system here, nothing much has improved. Some Nigerians say they will avoid local hospitals for now, not because they have alternatives, but because they fear doing so will put them at a greater risk for COVID-19. Ahmed Idris, Al Jazeera, Abuja.